Hi everybody, welcome to week 10 of your practicum course. This week we're talking about being student-oriented. Being student-oriented can encompass so many things. Oh, first of all, I'm coming to you from a portion of my front yard, FYI. It's nice out today. Anyway, being student-oriented can encompass so many different things, and I hope you bring out a lot of different components of that in your post this week. But one thing that comes to my mind when I think student-oriented is instead of thinking, how can I best teach this material, I try to turn it around and say, how can my student best learn this material? It's a little bit different mindset because I'm considering the student as far as their different learning preferences. Remember back to the auditory, the visual, the kinesthetic. How am I addressing those? How do I really pull the students into the learning process and engage them? So it's a very different way from straight lecture constantly. And for some of you, it may be very different from how you were taught in your pre-licensure nursing program. An example, I really enjoy teaching about respiratory. Anything from pneumonia to ARDS, any of that. And I think I particularly like respiratory because nurses can have such an impact on the progress of a respiratory patient. Positioning, encouraging fluids, cough and deep breathing, sensitive spirometry, ambulation, the things that we do with our patient, our nursing interventions, can just have such an impact on respiratory patients. And so I think it's fun. Oh, analyzing blood gases, I like teaching that too. Anyway. So when I'm teaching respiratory, I do have a component of my teaching that is what you consider maybe lecture-based with PowerPoints, although it's very much a dialogue. But then I have case studies. I bring out equipment for the students to look at. I usually present at least one video from a patient who has either asthma or COPD and what it's like to go through that struggle of not being able to breathe. I bring out or take the students to sim mannequins. We play assessment detective where they have to listen to different breath sounds and differentiate those. So I try to use a wide variety of teaching strategies to be able to engage my students and to do something that'll make it click for each one. Again, not the easiest thing. It's much more time consuming. It takes a lot of research, and for some people it really is thinking outside the box. You might hear something in the background. I'm outside, so you might from time to time hear people or cars. Sorry about that. Anyway, so one thing I'm sharing with you this week is an article about challenges of active learning strategies. Active learning strategies, we know, can be very effective. In recent years, we've seen a lot of nursing research being done on how effective active learning strategies can be, both with students, with staff, and with patients, with all of them. And so I love active learning strategies. But you do need to know when you're going in that there are challenges. It's much more time consuming. It's harder to manage a classroom. There's a lot of different things. So I'm going to include an article about the challenges of learning active learning strategies, and I'd like to hear your thoughts about those. How do you think you'll be able to manage that? How comfortable are you going to feel implementing those active learning strategies as opposed to putting together a really good lecture? So those are some things that I'd like to discuss this week. So we've got week 10. You're going to have an NEPD due this week. And then week 11 is that test analysis paper. So please send me any questions in the individual forum, in the questions for the instructor forum, so that I can help you out before it gets real close to the deadline, because it's kind of a big project. All right, I think that's about it. See you in the main forum.